Case study, Lyme disease patient. Hi everyone, I'm Dr. Michael Johnson. I'm a board-certified chiropractic neurologist. I've been in private practice in Appleton, Wisconsin since 1983, and I'm the clinic director and founder of the Optimal Health Stem Cell and Wellness Institute. So I want to share with you the file of a 45-year-old female that was diagnosed with chronic Lyme disease. Now, I've said in just about every case, it's more than just stem cell therapy. Way more. And this is certainly the case with this patient. You can't just do stem cell with Lyme patients. In many cases, they'll get worse. You have to look at the blood work. You have to look at the hormonal panels. You have to look at complete trigger testing. So you're looking at just not the Lyme infection, but other co-infections and toxins and heavy metals. And you have to look at the genetic testing. So this patient presented on January 9th of this year, 2019. She complained of chronic fatigue, severe brain fog, memory loss, executive functioning distorted. She's not thinking clearly. Burning skin, nerve problems, shooting down the right side, weight gain, even though she eats autoimmune paleo, muscle pain, her joints hurt, blurred vision, hearing loss, light sensitivity, depression, anxiety, temperature sensitivity, and Raynaud's. Raynaud's syndrome is the whiteness in the fingers and the toes, the lack of blood supply. To date, she was diagnosed with Hashimoto, Lyme infections, other co-infections, fibromyalgia, ADD, depression, anxiety, adrenal fatigue, chronic fatigue, hormonal imbalance. So I spoke to this patient last night, and she's doing great. She's had the blood work done. She's had the trigger testing, the genetic testing. We have not done the Dutch test with her yet, because of the fact that she had very low pregnenolone. And pregnenolone is the master hormone. So that is upcoming. To date, she's had 8 cc's of umbilical cord stem cells. Her pregnenolone level was 36. Normal is about 150 to 200. She is hypoglycemic with a low blood sugar. She did show on her blood test kidney issues with her blood urea nitrogen being a bit low. And she also has low stomach acid or hypochlorhydria, which is evidenced with the chloride and the protein. Her ALT, her liver enzyme, is 45. Normal is 10 to 26. Her AST is 29. Again, normal is 10 to 26. Her serum iron, she's slightly anemic, is 82 with normal at 85 to 135. Her C-reactive protein was quite high. Should be as close to 0 as possible. She was 13.8. Her cholesterol is good at 214, but she's not converting cholesterol to pregnenolone. TSH, she's got Hashimoto's and thyroid issues, so her TPO and TGB antibodies were high. She is taking vitamin D, or was taking, and that was pretty good at 72.10. Her homocysteine was just slightly high at 8.10. So this patient, obviously, like I mentioned, needed more than just stem cell therapy, which is what we provided, which is why she's responding so well. Now, she's coming back for her 3rd round, probably in August. I'm doing this video in July. Hopefully we'll get her on video. Hopefully she'll be open to that. Some people are, some people aren't. I wish everybody was, but not everybody wants to get on video. I just had a lady ask me today, well, have you helped with, what was it, Sjogren's syndrome? Yes, we have excellent results with all autoimmune issues. Well, where are your videos? I can't help it that I've had patients that didn't want to go on camera. It's frustrating to me because we're getting people better. Nobody else can get better, but I respect their privacy. So, anyway, I was talking to this patient last night. Listen to this. She is under tremendous stress, and I'm so proud of her. She was going out with her boyfriend for 3.5 years, and he, after they got married, left the marriage and left her with all the bills. She had quit her job and started a new company, and she is under tremendous stress. But this is why I wanted to make this video. Even with all the stress that she is under, she's not slipped backwards. She is doing great, fantastic, and that's exciting to me. And she thanked me. She was my last call. So what normally happens, folks, is Tuesdays I have distance patient calls. What does that mean? I keep in contact with all of our distance patients, and the vast majority of our patients are from a great distance. More than 2 hours from Appleton, sometimes around the world, all over the country. So she is doing fantastic. And so she was my last call of the night. I was out for a walk. I do exercise. And we just had a very, very nice conversation. So my point being, I don't care how severe the condition is. I don't care how bad you're feeling. I don't care how many physicians have told you there's nothing that can be done for you. Those are the type of people that we help. And again, it's not just stem cell therapy, although we inject stem cells into the brown fat. Brown fat's highest concentration of mitochondria. We've seen the greatest success with it. I don't do the injections, the nurse practitioner does. But we do complete blood work, just as I laid out for you there. We do complete hormone testing, but you start off with the pregnenolone. Remember, her pregnenolone was very low. We're going to come back and check that, and then if it's higher, we'll do the Dutch test to check the rest of her hormones. You look at genetic testing. You look at trigger testing. You have to remove toxins and infections, and with Lyme, there can be other co-infections. So it has to be a holistic approach. And if it's not a holistic approach, that's a problem. So, I'm Dr. Michael Johnson. Thank you for taking the time to watch this video. You're welcome to email me. I'm at drj@ohstemcell.info. Share this video. Share all my videos. Our website. Watch our testimonials at ohstemcell.info. No, there's probably 3 times as many of those testimonials, but I wish everybody would get in front of a camera, but not everybody does. If you need supplements, drjsupplements.com. Again, share this video, all my videos, with family and social media. Subscribe to my YouTube channel if this is your first video with me, and thank you. Thank you for taking the time to watch this video. Thank you for sharing my videos. Thank you for subscribing. I'm Dr. Michael Johnson, and I look forward to helping you in the future.